there was comfort in what was in 2019 before the pandemic. There was comfort in what was before this last election, and that if only we can go back to that. But I have been saying to them, and I'm saying here as well, speaking with people in these communities, Maha is an umbrella for frustrations that so many of us have felt for so long. I've worked in emergency medicine for 18 years. I've heard for nearly 2 decades the frustrations people have about this healthcare system. And I see so many of those coming together at a time right now when it feels like there's an assault coming from every direction. It also feels like the way that we need to engage is like listen on social media and find better ways to communicate. What I have found, and I think this is hard for folks that might be under 40, is that the best way to communicate, is to get together with people that you disagree with. I have been in so many rooms with people I have very little overlap with, particularly in public health. It hasn't dramatically changed the way that I feel about a lot of things, but it has opened up my own understanding and my own knowledge. One, about what I think and why I think with such certainty, but also my ability to engage with others. And I am really profoundly impressed with how so much of that narrative has changed over the past year, where we went from being rightly harmed and angry with the destruction we've seen of our field to understanding that there is opportunity in this moment, that entropy is uncomfortable, but it represents an opportunity for us to think about and do something different for our way forward.